The Medical and Dental Council slapped a hefty fine and a harsh suspension on integrative herbal specialist Dr. Gilbertha St. Rose for her advocacy and use of ivermectin. The news came as a surprise to staunch allies of the medical practitioner, who were awaiting the results of the hearing following further dialogue between Dr. St. Rose and the St. Lucia Medical and Dental Council. Attorney-at-law Mary Francis was also taken aback by the outcome.
I'm rather shocked and disappointed. For me personally, it is sad because having known Gilbertha from the days of St. Joseph's Convent from Form 1 on to Form 6, I know the type of person she is, and she was a very brilliant student at the convent. And for me personally, who know her, it is sad for me that it has reached that stage.
Dr. St. Rose was forewarned by the medical authorities that ivermectin was not approved for the treatment of COVID-19 in St. Lucia. In the wake of the council's ruling, she will not be able to generate an income from her practice since her medical license has been suspended for 6 months. She also has 30 days to pay a steep fine of $10,000. Longtime friend Mary Francis is stunned by the punitive action.
I find the penalty is too draconian. She has not caused the death of anybody. It is alleged that she has been prescribing the ivermectin and so forth, but I have not heard of any deaths. I do not know all the information which the council had before them, but I find that it is draconian. To suspend her for 6 months and to then to put a fine of $10,000, she cannot earn a living. How can she pay that fine?
Francis points to the slow uptick in vaccination on island as cause for the Medical and Dental Council to tread cautiously. More than 70% of the nation remains unvaccinated, with hesitancy, skepticism, and resistance to the jab undermining public health efforts. Only 25% of the population have been inoculated. Health experts have repeatedly stated that vaccines are safe and effective and have been proven to reduce the odds of severe illness, hospitalization, and death from COVID-19.
To me now, the lines, battle lines are even drawn more firmly between herself and the medical and dental council. And I really thought at least there would have been a more conciliatory approach on their part, knowing the resistance out there in the society.
The debate over ivermectin is currently being waged the world over, with reputable health agencies explaining that the jury is still out on the anti-parasitic for the treatment of COVID-19. The drug is not recommended for the treatment of the viral disease and is only permitted under approved clinical trials. Solange Alfred, HCS News Force.